Overview of billing signature captures for image trend. So when you are capturing the HIPAA agreement and release signature for your chart, for your PCR, it's important to remember that the primary objective is going to be to capture the patient's signature for your chart. That is the most direct path to billing, the easiest way for Health Claims Plus to bill the patient's insurance and assure that everything gets billed properly. There are times where other authorized representatives will sign on behalf of the patient, and we have signatures to allow them to do that. So what are the signature options? So when you go to the signatures page and click Add, you see that the HIPAA acknowledgement and release buttons are kind of in order of preference. So the first one is going to be patient. So if you've already loaded the patient name into your chart, you click Get Patient Name, and we see Mr. Joe Sample. We can have them read the signature form which they are signing. I encourage you to do that. Give them the opportunity to read it, ask any questions. Then they go ahead and sign. Remember that we do carry paper copies of the HIPAA information release in the clipboard on the ambulance, and we are required to offer them a copy of that if they so desire. We timestamp it, and then if the patient is signing, then the only option you need to pick is signed. And then we say OK, and then you are done. Easy peasy. And that is the #1 best option. It should be your primary selection. Most of your charts, I would say 90% or better, should get the patient signature. It should be less often that you are getting a patient representative signature. So, patient representatives. You might need a patient representative signature if the patient is mentally incapable of signing. That is, they are confused at baseline, so they have a dementia diagnosis or Alzheimer's diagnosis. If they are just confused for this particular scenario where they have, say, a traumatic brain injury that is causing them to be altered, or they are intoxicated, causing them to be too altered to be able to understand your instructions and cannot sign on their own behalf, or they have some sort of electrolyte imbalance, they are septic, can't sign on their own behalf, can't understand instructions, can't follow directions. These are all cases where they are mentally incapable of signing. They may be physically incapable of signing. They've got bilateral broken upper extremities where they are physically unable to sign, or they've got an eye injury where they can't see the screen, or they are blind. They are not able to see the screen. These are all reasons where they are physically unable to sign and in need of a representative to sign on their behalf. They may also be in law enforcement custody, and so in that case, they also need a representative to sign on their behalf. If they are in law enforcement custody and being transported against their will for medical evaluation, then of course the patient may refuse to sign, and in that case, a law enforcement officer from the authority having jurisdiction will sign on their behalf as they are the one directing transport. So let's start with an example. Say you are at a patient's residence. The patient's having an MI. They are anxious, very upset. You ask, hey, before we take off, I just need your signature here on this tablet here, giving us permission to bill your insurance for the trip we're about to take. And they say, you know what, I don't want to sign anything, just have my daughter sign it for me. She signs a lot of my paperwork anyway. And you say, okay, that's no problem, Mr. Sample. We'll go ahead and have your daughter Carla here sign on your behalf. And you say, Ms. Carla Sample, if you don't mind, come on over here. Your father asked if you don't mind signing for you. She says, yeah, sure, no problem, I'll sign. You get a timestamp, and then you go to signature status, and you pick down here, and we see an option for not signed due to distress level. And that would be the most appropriate option. Obviously, the patient was upset, and they said, please just have my daughter sign for me. And we say, okay, and there you go. Patient representative signed on behalf of the patient. You document in your narrative that the patient was upset and requested that his daughter sign on his behalf, and away you go. Let's say you are at Bluebonnet Nursing. They've requested transport for a patient to Otto Kaiser for bad labs. The patient has an underlying diagnosis of dementia. They do not sign their own paperwork, but family is not on scene. You say, okay, hey, Nurse Ratchet, while you're here giving me a report, I just need you to sign my tablet for me because we can't transport without a billing signature. Just go ahead and sign for me, and then you're going to pick why the patient couldn't sign. Obviously, if it's a dementia diagnosis, it's going to be mental status impaired. Let's say they have contractures of the upper extremities, it's going to be physical impairment, and we'll pick that, and we say, okay. Again, none of these require the EMS clinician to sign on behalf of the patient. These are all scenarios where there is an authorized representative of the patient on scene, able and willing to sign on behalf of the patient. Let's say we're at the Connolly unit. Patient fell down, hit his head, has an obvious hematoma, and medical staff is saying patient needs to be transported out for a head CT. Patient's telling you to go kick rocks. I don't want to go. And the warden has ordered that the patient shall be transported for medical clearance. And they are saying, yes, the patient will go. Okay, well, no problem. We're going to need a signature from the person who is maintaining care, custody, and control of the patient. So again, that's going to be a patient representative signature. So we'll get a signature from, Timmy Smith, badge number, whoever, and that's going to be law enforcement because they are from the jail. Timmy's going to sign, and the patient is going to be not signed in law enforcement custody, and away we go. Same deal if it's a traffic stop on the side of the road. Deputy says patient needs to go to the hospital for medical clearance subsequent to arrest. Patient says, I don't want to go. Law enforcement says, absolutely, you're going with EMS. In that case, the patient, again, is in care, custody, and control of a law enforcement officer. They are detained. They are under arrest. Law enforcement says where and when they go. So we need a signature from law enforcement on behalf of the patient. Ideally, law enforcement will go in the ambulance with the patient. Sometimes because of staffing, they will follow. But in any case, we need a signature from law enforcement on the PCR prior to transport, authorizing transport and billing for the patient. So let's say it's a minor. Obviously, this is maybe a no-brainer, but minors cannot sign on their own behalf. Again, this will be patient representative. So we say we get a signature from, Mommy Smith, and this will be, Mom. And the reason for the signature is not signed because the patient is a minor or child. And away we go. Okay, so lots of examples there where the EMS clinician does not need to sign. So you might be asking, well, if we have all of these options and the patient can sign or a representative can sign, why in the world would an EMS clinician ever need to sign the report? Well, frankly, you probably don't ever need to sign the report. There are very few circumstances under which an EMS clinician cannot find an authorized representative or a patient able to sign the chart. But in the rare circumstance, let's say you come upon a motorist on the side of the road, called in by a third party. Turns out they were just taking a nap. They consent to checking of vital signs, but then when it comes to signing the refusal, they tell you to kick rocks. They don't want to sign anything. So you need to sign the chart, and you need to document that they refused to sign. In that case, it would be EMS care provider. You would sign, timestamp, and you would go down, you would say, not signed, refused. And you would need to very carefully and specifically document in your narrative that the reason why the EMS care provider needed to sign as a means of last resort, that there was nobody else on scene who could sign on behalf of the patient, and the patient could not sign and refused, that it was a means of last resort why the EMS clinician needed to sign on behalf of the patient, in this case because they refused. It is not simply a matter of convenience. We need to do our due diligence and make a best effort to get signatures from healthcare providers, from family members, from the patient themselves. Getting the signature from the EMS clinician on behalf of the patient is generally not sufficient for billing, and usually leads to delays in billing practices and causes Health Claims Plus to have to circle back and get billing authorization from the patient, from the family, or from the facility after the fact, and causes delays in billing down the line. So, happy to answer any questions you have regarding any of these. And as always, thank you for everything that you do.